A 6-year-old boy is brought to the emergency department because of a 2-hour history of bloody diarrhea following the onset of flu-like symptoms earlier that day. 2 days ago, he had gone to a petting zoo that recently opened. His temperature is 37.4. Physical exam shows no other abnormalities. Laboratory studies show a normocytic normochromic anemia and a serum creatinine concentration of 4. What mechanism is the most likely cause of this patient's acute illness? Please put your answers in the chat. So I think the first thing I'd want to ask the students before we get into the content is, what are your thoughts about seeing a question like this and not having the option set in front of you? How does it change your approach?
I think it's actually help you to find the answer before getting tricked by the multiple choices. You have something in your head set and then you know what's the correct answer or almost correct answer. So you look at the answer choices and you can eliminate many of the answer choices based on that.
Thanks, Shakira. It's also in some ways validating for our process when we have learners or students look at questions without the option set. And if it's hard to come up with even a general idea of the answer, it could be something with how non-specific the question was. So
I found that it really made you think on a tree level of how specific you need to be on what the answer is. So originally I thought of a particular bacteria, but maybe you're not asking for that. Maybe you're asking for something higher level. So I just went with infection and then the vector-based infection. So it really made you think on a larger spectrum than I would have if there was answer choices listed.
thanks, Nia. And I guess it's also sort of inherent in the lead-in to make sure when they ask for mechanism, you have to know exactly what mechanism means. And sometimes maybe it takes the option set to actually get an idea of what they're truly asking for.
So for me, just having to think about it without the answer choices kind of lets me, hone in on what mechanism, if it's something very specific, what mechanism I would want to be looking for. For instance, like if I'm thinking of a certain bacteria, um, I can think about the virulence factors involved with that bacteria. Therefore, if I see very specific mechanisms for the answer choice, I'll have a better idea of what to be looking for.
One of the things that I thought about is it's kind of like when you take away the answer choices, it kind of puts you more in like an emergency physician role of like you're completely undifferentiated. Whereas when you have the answers there, you at least have some like differentials to go off of, so you can kind of look deeper into, I guess exactly what they're asking. Because so far from this, it seems so broad. But if if you're given like exactly the mechanism of how salmonella works or exactly the mechanism of different bacteria, then you at least know what to look for and specifically hone in on.
Stephen, what you're somehow alluding to actually is one of the important lessons of this is that we're really looking at a second or even a third order question here, because you think about what competencies you have to bring to bear to answer this correctly. You're going to have to recognize the clinical scenario, a 6-year-old boy that comes in with this presentation. You're going to have to know the likely infectious agent, but then you're also going to have to know the mechanism of that infectious agent. So this is a good example, I think, of a third order type of question.
I was just thinking, like everyone's already stated, but it's so broad, and you're like, where do I start? Because there really are a very large number of things that could be in these answer choices, whether it's what is the mechanism, if they want a detailed step-by-step mechanism, or just a virulence factor, or maybe the answer choices will be infection with, and then describe a certain bacterial or viral structure, and then have to differentiate based on that. So I think it's good, not only on the actual exam, but when you're preparing for the exam, to do a question like this, because then this one question really becomes 10 or more questions in terms of prep.
You got it, Zach. That's a great tip. You take a question like this and you map it out and think about, okay, what are the 10 different things that Dr. Nori could ask me about this condition? It could be mechanism, it could be diagnosis, it could be treatment, it could be all these different types of things. But remembering, the level that, they're also not going to be step 3 level questions. You're not going to be expected to know things that an intern, let's say, would be expected to know. Now I'm going to invite Dr. Nori to comment on your responses and some of the content of this before we reveal the option set. Dr. Nori.
Sure, thank you. I really like what I'm hearing here as an instructor in infectious diseases. I can't tell you how happy it makes me to hear you all on the path to arriving at the concept that we would like you to walk away with as item writers for NBME. So, Stephen, what you said was really spot on in that this patient is most likely to present to an acute care setting because they're quite ill. As an infectious disease practitioner, the things that immediately stick out to me that I would want to also convey to somebody that I'm helping to manage the case with, and also to students and house staff, is that look how quickly this happened to this child. Presumably the exposure here was only 2 days ago at this petting zoo. And within 48 hours or so, he is very ill with bloody diarrhea or dysentery, and also acute renal failure. Let's hold on to that for a second. But one thing I do want to mention here is that as item writers and as the committee and NBME in general, we do not insert things that are intended to trick students. We try not to insert things that lead individuals down the wrong path. Everything we provide is very meaningful and intended to guide you and to help you. So that history there of the petting zoo 2 days ago is not a distractor, but is probably playing a role here in the child's exposure to this illness. The differential here is otherwise quite broad, but there are a couple of things that help you narrow this further. Lots of you arrived at an infectious diagnosis, which is great. So this will tremendously aid you as somebody on the front line who's helping to take care of a patient like this, and understanding that this is most likely an infectious mechanism versus something else will automatically put you on the right track to then treating this patient. Taking it a step further, understanding the mechanism of this, let's say, bacterial or other type of infection, will then help us to select the right kind of treatment for this patient as well.